Topic number 2, the lymph system. So let's start by talking about how the lymph system works. Starts with what you eat. You eat food, your gut breaks it down into usable sized nutrients, gets into your bloodstream, and then your heart pumps these nutrients all over your body. Your heart is a very strong pump. So from your heart to your arteries, to your capillaries, to your veins, back to your heart. That's how blood moves. And at the capillary level, which is the smallest blood vessel, I like to think of capillaries as tubes with holes in them. Since your heart is such a strong pump, it forces these nutrients out into the surrounding tissue, and that's how your cells get what they need. They also give off waste products, and it's your lymph system's job to go and collect up all this fluid in the tissue. I like to picture your lymph system like roots. So it's collecting up this fluid and it's bringing them to areas with lymph nodes. Now you have between 600 and 700 lymph nodes in your body, and they're strategically placed a lot in your abdomen, your head and neck, your groin, your armpits, along your chest, your vital organs, because your lymph system is a huge part of your immune system. So as this fluid is getting collected up, it gets filtered by lymph nodes, and lymph nodes are very specifically looking for potentially harmful things like cancer, bacteria, viruses, things that would prompt an immune response to start producing white blood cells to protect you. Your lymph system also has very specific territories. So as that fluid is getting collected up, it's being brought to a very specific part of your body. Your right upper quadrant, which would be your arm and your chest, your left upper quadrant, your abdomen, your right leg and hip area, your left leg and hip area, the right side of your head and neck, the left side of your head and neck. These are all specific territories. So the first question is, what happens to the lymph system during cancer treatment? Well, typically lymph nodes are surgically removed. And the reason is because of these really specific territories, your oncologist is looking for if cancer has begun to spread from that original tumor, it's very predictable where it's going to end up, which part of the lymph system. And so they'll remove that lymph node, or there's a procedure called the sentinel lymph node where they actually put a dye in the tumor, and then they take out the lymph node that collects that dye, because again, it's very predictable that the lymph system is going to be, a particular part of your lymph system is going to be draining the fluid from that particular part of your body. So they'll take the lymph node out to check for cancer cells. Now, once the lymph node is removed, your body doesn't have a way of regenerating a new lymph node. You do form new lymph vessels, however. Scar tissue from radiation or from surgery can also damage lymph nodes or block the lymph vessels from being able to get to the lymph nodes. So it can slow down the collection or make it a lot harder for your lymph nodes to get that fluid that your lymph system is collecting up. So what is lymphedema? Well, lymphedema means edema or swelling because of damage to the lymph system. So your lymph system isn't able to process the amount of fluid that's being circulated through that area. And if swelling results, that's called lymphedema. There are other types of edema. Chemotherapy can cause certain types of edema, heart problems, just other types of swelling and inflammation. Lymphedema would occur in a predictable part of the body. So for example, if you have lymph nodes out of your right armpit, if swelling occurred in that right arm or chest, that would be the area that we're concerned about. So if you see the at-risk area, that means the territory where the lymph nodes were removed. Is lymphedema preventable? Well, If there's enough damage to the lymph system and it's just not able to keep up with the amount of fluid, lymphedema will occur. However, there are a lot of ways that you can support your body, support your lymph system, support that healing process so that you could delay or minimize, or in some cases prevent the actual swelling from happening. So let's talk about how to support your lymph system to allow optimal healing and function. One is movement. Muscle contractions help to pump fluid throughout your body, helps facilitate that fluid getting towards the lymph nodes. Stretching opens up scar tissue so it's less restrictive. Breathing helps to oxygenate blood and also pump fluid throughout your body. Muscles demand blood, so when you're exercising, your heart pumps harder and it helps to push more blood and nutrients to specific parts of your body. So exercise is a really important way to help your lymph system to function optimally. Next is hydration. Fluid is easier to pump than paste. So being well hydrated is really important for moving fluid, getting nutrients to your body, but also removing waste products from your body. The better hydrated you are, the easier it is for your body to move fluid. Hydrated tissue is also more flexible. So again, if we're talking about scar tissue and restrictions, the better hydrated you are, the easier everything's going to move and pump around. Next is flow. So tourniquets restrict flow. So tight elastic bands or jewelry are potentially blocking flow from happening. A lot of this fluid that we're talking about getting collected is right under the skin, so it doesn't take a lot of pressure. If it's wrapped around, it doesn't take a lot of pressure to restrict that flow. Scar tissue can also restrict flow. There's a lot of scar tissue around the area where the lymph nodes were removed. So again, loosening up that scar tissue is really important. Elevation also promotes flow, so taking gravity out of the picture. When your arms are down, your body has to work really hard to pump that fluid back towards your heart. If your arm is raised overhead, gravity is working in your favor to bring that fluid back to your heart. So elevation is a good way to promote flow, make it easier for your body to do what it's trying to do, which is bring fluid back towards your heart. The next is protection. So protecting your bodies from injury, infections, sprains, bruises, basically damage to the cells brings more fluid to the area so they can get platelets and white blood cells and things like that to heal the area. The problem is your lymph system then has to remove that excess fluid, so it's more work for your lymph system. Use protective clothing, gloves, depending on this at-risk area, long sleeves if you're working in the blackberry bushes, or long pants if you're, hiking through an area where you could get a lot of scratches or bug bites or things like that. Avoid injuries. Something that's really common that you hear are don't get IVs or blood pressure taken in your at-risk area. The reason is sometimes blood draws or IVs can cause a lot of local inflammation, and so that could potentially be the thing that kind of overwhelms your lymph system in that area and starts swelling to occur. Same thing with blood pressure cuffs. It shouldn't cause a lot of inflammation, but sometimes the person has to try a couple of times. It can cause some local vessel damage or act like a tourniquet. So avoid what you can. Injury prevention, so being strong and flexible is a great way to prevent your body from getting injured while you're being active. Train for sports, add in weights kind of gradually so that your body is building up the strength and flexibility to do things safely. Take care of your skin and your nails. So monitoring your body for infections, looking for red spots or warm spots. So traveling is potentially overwhelming to your lymph system. Travel is a sort of a perfect storm. So let's take a scenario of somebody's lugging around a really heavy suitcase. They haven't been doing a lot of lifting and things. They're lugging around this really heavy suitcase, which is kind of aggravating their shoulder. And then they're very sedentary in the plane for a while. And then they're in really high altitudes. So high altitudes, there's less pressure in the air around you, and so it's easier for fluid to get out of the vessels and a little bit more challenging for the fluid to get back into the vessels. People also tend to be dehydrated while they travel, so it's kind of a perfect storm of stress on the lymph system. Not that you should avoid traveling, you should just be aware of what's going on so that you can be well hydrated, move around on the plane, let somebody else carry your heavy suitcase, or even better, train up to it so that you're nice and strong and flexible so that lugging around this suitcase isn't stressful to your body. Compression, I'm not going to go into a lot of detail, it's a long topic, but basically what compression does, like compression sleeves or compression stockings, they provide outside pressure, which when your muscles are pumping, makes it a more effective pump. It's got a little bit more force behind it. It also helps to prevent fluid from building up in the tissue in the first place. Some people will use it preventatively to help promote circulation, and that's something definitely to talk to your physical therapist or your lymph specialist about, do I need compression and how do I use it properly? Early detection is really the key to lymphedema. If something is happening, the sooner you notice it, the easier and more successful the treatment is going to be. So monitor your body for changes in size. And again, if you've had lymph nodes out on the right side of right armpit, then you would be comparing your right and your left arms. You're looking for the visibility of veins and wrinkles. If one side suddenly starts looking younger and less wrinkles, it could be because there's fluid building up. So paying close attention to how things look, but also how things feel. If the at-risk side is starting to feel heavy or tingly or anything unusual, have it looked at sooner rather than later. Because if it is lymphedema, then the sooner the better. The last is tranquility. So stress suppresses your immune system and your digestion. The idea is the old fight or flight. So if you're under stress, your body prioritizes resources to your brain and your muscles, which is fine if there's something that you're reacting to and you're taking care of it and then it's done and you can go back to a tranquil state. Chronic stress means that your immune system or your lymph system is chronically suppressed. It's not getting the resources that it needs. So, breathe. Take a deep breath. Do what you need to do to get a good night's sleep. There are a lot of resources out. One is called mindfulness-based stress reduction, which is teaching you some techniques that you can do to reduce your own stress. Have fun. Do things you enjoy doing. Be around people you enjoy being around. All of those things really help to reduce stress and therefore give your lymph system the resources that it needs to function optimally. Thank you.